Pattaya City Expats Club is a non-profit social organisation and our speakers are volunteers. The club as such assumes no responsibility or liability for the professional reputation of or the quality of services provided by the speaker today.
And Swadee Krub. Well, today we were blessed to have Dr. Tanakorn from Bangkok Pattaya Hospital here, and he gave a wonderful talk on strokes, which you called Stroke 101. Why did you call it Stroke 101?
Okay, because the 101 is like the fundamental knowledge or the basic knowledge that you when you go when back to your college. You learn in any subjects. It's going to have the 101, 102, right? So this is like the fundamental knowledge of the stroke.
And I think that is exactly what the talk was. It's really fundamental knowledge that pretty much everyone needs to know, because it was really, really thorough and really specific. And it made me think, because what are the major risk factors for stroke?
Well, the major risk factor of stroke is the diet control, the high blood pressure first of all, and then it's about your high blood sugar level, your high lipid level, and also your inactive activity.
And those are factors you can control, but then there's some factors you cannot control, right?
Well, the factor you cannot control is the factor that you were born with it, just like your age, your sex, your race, and your history, your family history.
Because I think people from Afro-American backgrounds have a higher incidence of stroke. Is that right?
Yes, mostly of the African Americans or the non-Hispanic American, they got a higher risk of stroke because of the racial factors.
And I think I found out today that I have a higher risk of stroke. My father had a stroke, and my grandmother on my mother's side had a stroke.
Well, if you have the history of your family, especially your first degree member of your family, like your mother, your father, or your grandmother, your grandfather had got a stroke, so that's when you will get more risk of the stroke when you compare to the normal people who don't have the family history of stroke.
And if you suspect you've had a stroke or somebody else has had a stroke, what are the signs that you look for that they've had a stroke?
Okay, well, the short sign, the sign that when the warning sign for a stroke is about the suddenly happened in one side of your body, just like your numbness or weakness on one side of your body, or your facial weakness, or your slurring speech. So I would like to give you like a shot of the mnemonic letters to make you more recognize about the sign of the stroke. It's FAST. Okay, F stands for the face. If you have like a drooping face or have like a one of your face like not symmetry, it's going to be the sign of stroke. A is about the arm, and that's when you have a weakness or a numbness in one of your arm. It can be the sign of stroke. And S is about speech. If you have the speech difficulty or you cannot understand the language, it also can be the sign of stroke. And T is about the time. So if you got these kind of symptoms, or you find someone you have these kind of symptoms, call the emergency or ambulance immediately, because timing is very important for treatment of stroke.
So there it is. Time is critical, because time is brain cells, right?
Yeah, that's right. The time loss is when your brain lost. So if that's like these symptoms or this disease, you have to be rest of the time. So you have a limit time window for the treatment.
So on that note, just remember those things. It's better to go, if you're not quite sure, get to the hospital, right? Even if it's a transient small stroke. And have a look at this talk, because this is Stroke 101, and the risk of strokes in certain countries is like high, right? It's a very high risk of death in the USA, for instance.
Yes, that because the date of the stroke is about 140,000 of the people die each year in the US. So that's mean like every 4 minutes, one people die from stroke.
What? That's it, one people die. Forget about the non-death ones. One people die every 4 minutes. So this is something to take seriously, right? And you won't get a better talk, more thorough and more well organised than Dr. Tanakorn's talk on strokes. So do yourself a favour, do your family a favour, watch it all together. So I really want to thank you. Your maiden public talk.
Thank you. Thank you very much.
And it was wonderful. So for now, it's goodbye and Swadee Krub, and remember, fast, okay? Time is not your friend.